Imagine being strapped to a table, feeling the cold metal beneath you, as a surgeon raises their scalpel to make the first cut. You felt pain before, but this is different. Every stitch, every snip, every scrape of metal on bone would be like a fire raging through your body, with no escape from the agony. You'd see the surgeon's hands moving, their face focused, but it's like they're 1,000 miles away, because all you can feel is the pain. It's hard to even comprehend, isn't it? Could anyone really survive something like that? The thought sends a shiver down your spine, and yet this was the reality for countless people for centuries. What would it be like to truly feel every moment of a brutal surgery with no anesthesia to dull the pain? You felt pain before, but imagine it intensified, multiplied, and prolonged. Surgery without anesthesia was a nightmare that became a reality for millions. As many as 90% of patients didn't survive, a staggering number that's hard to wrap your head around. The procedures were brutal, with patients convulsing in agony, their bodies screaming in protest. Surgeons' assistants had to restrain them, holding them down as they thrashed and screamed. The air was thick with the smell of blood and sweat, and the sound of those cries still echoes through history. It's a horror that's difficult to comprehend, and yet it was the norm for centuries. The question still lingers: how did they survive such unimaginable torment, and what drove the quest for a solution to this abyss of pain? You can barely wrap your head around the fact that this nightmare went on for thousands of years. The earliest signs of surgical procedures date back to ancient civilizations, with evidence of trephining, a form of skull surgery found in the remains of ancient cultures. Imagine the countless people who underwent this brutal procedure, their skulls scraped and cut without any relief from the pain. It's a haunting legacy that spans millennia, touching every corner of the globe. The numbers are staggering. As many as 90% of patients didn't survive these early surgeries. That's a mortality rate that's almost impossible to fathom. And yet, it was the reality for so many people, a reality that drove a desperate quest for a solution, a way to escape the unanesthetized abyss. Imagine being one of those patients, lying on a cold wooden table, feeling the surgeon's scalpel slice through your skin. You're awake, aware of every cut, every stitch. The pain is like nothing you've ever felt before. A young woman, Anne Green, underwent such a surgery in 17th century England. Her screams still echo through history. As the surgeon's assistants held her down, her body convulsed in agony, her eyes wide with terror. The air was thick with the smell of blood and sweat. You can almost hear her screams, feel her desperation. And then, just as suddenly, everything goes silent. The procedure is over, but at what cost? Her fate, like so many others, hangs in the balance. You're left wondering what happened to her, and then you hear the story of Anne Green, a young woman who underwent a brutal surgery in 17th century England. She's strapped to the operating table, her eyes fixed on the surgeon's scalpel as it slices through her flesh. The sound of her screams echoes through the operating theater, a chilling cry that freezes time. The surgeon's hands move with precision, but Anne's body convulses in agony, every nerve screaming in protest. Her assistants hold her down, their faces grim and determined as they try to keep her still. The scalpel glints in the light, a flash of steel that seems to linger in midair, and for a moment, everything hangs in the balance. Surgeon's hands don't flinch, but the patient's body arches backward, straining against the assistant's grip. You can see the muscles in her neck standing out like ropes, her face contorted in a silent scream. The scalpel bites into her skin, and a thin line of blood appears, beating up like tiny rubies. As the surgeon makes the first incision, the patient's eyes snap open, and she lets out a sound that's almost a shriek, but it's muffled by some unseen force, like a wild animal trapped in her throat. The assistants lean in, their knuckles white as they try to hold her down, and for a moment, it seems like they're the only thing keeping her from flying apart. You can see the tendons in the assistant's neck straining as they press down on her shoulders, their feet scraping against the floor for traction. The patient's arms flail wildly, like a bird in a gale, and one of her hands slips free, slamming into the surgeon's thigh. He grunts, but his eyes never leave the incision site, his fingers moving with a practiced precision that's almost mesmerizing. The assistant on the left loses his grip for a split second, and the patient's head whips to the side, her eyes rolling back in her head like marbles. The sound that comes out of her is almost a growl, a low, feral noise that makes the hairs on the back of your neck stand up. And still, the surgeon cuts, his blade slicing through tissue with a soft, wet sound. The surgeon's hands don't flinch, but the assistants holding her down are sweating, their knuckles white with tension. You can see the fear in their eyes, the knowledge that they're witnessing something that no human should have to endure. The patient's body is convulsing, her limbs thrashing wildly as she tries to break free. The sound of her cries is deafening, a cacophony of agony that fills the room. And then, just as suddenly as it began, everything goes silent. The patient's body goes limp, her eyes frozen on some distant point. The room is quiet except for the sound of heavy breathing and the surgeon's voice, low and steady, saying, "Almost done." But at what cost? You can almost feel the weight of that silence, the stillness of the patient's body, a stark contrast to the chaos that came before. The surgeon's words, "Almost done," hang in the air, a haunting reminder of the ordeal that's been endured. And for what? So the patient might survive, or so they might not, the outcome still uncertain. The room is a scene of exhausted relief, the medical staff's faces etched with the strain of holding down a person in agony. The patient's eyes, frozen on some distant point, seem to hold 1,000 unspoken questions. What will be the price of this procedure, and will she ever be the same again? The surgeon's hands move with precision, but the true cost of this surgery is only just beginning to reveal itself. You're probably wondering what it was like to be a patient after this groundbreaking moment. Well, imagine being one of the first people to undergo surgery with anesthesia. It's like being part of a secret club where the password is no pain. As more doctors start using anesthesia, hospitals transform into relatively calm places, with patients no longer screaming in agony. The sound of steady breathing becomes a familiar hum in operating rooms. And it's not just patients who benefit. Doctors can finally focus on their work without the distraction of a patient's pain. They can make more precise cuts and perform more complex procedures. It's a ripple effect, with anesthesia changing the face of medicine, one quiet, painless procedure at a time. And in the shadows, a new kind of patient emerges, one who can sleep through the worst of it and wake up to a new reality. You can almost imagine the sigh of relief that echoed through hospitals and operating rooms as anesthesia became the norm. But have you ever wondered what happened to the people who used to hold down patients during surgeries? The ones who had to physically restrain them while the doctor worked? Well, they're not needed as much anymore. With general anesthesia, the struggle is gone and surgeries become more like, well, surgeries, rather than resting matches. It's a strange thing to think about. But the advent of anesthesia didn't just change the medical field, it also changed the jobs of people who worked in it. And as you think about all the people whose lives were altered by this one discovery, you start to realize that the ripples of progress can be felt far beyond the operating room, in the lives of people you'd never even think to consider. You're waiting for a breakthrough, something to shatter the darkness of those operating rooms. And then it happens. William Morton steps forward in 1846, a pioneer with a daring plan. He's about to demonstrate the power of anesthesia.